Hi, my name is Dr. Mike Baumholtz, and I own and run Baumholtz Plastic Surgery. A couple weeks ago, I made a video about managing expectations in the context of what people think of as what plastic surgeons or what I do the most of, and I made the story about how I predominantly spend my time when I meet patients managing expectations. And what I want to sort of ramble on about for a few minutes today is the corollary or sister to that conversation about what happens when expectations either aren't met or a procedure was done and the expectations weren't realistic, and now you have an unhappy patient on the other end of a conversation. And I've been thinking about having this video for quite some time. I know I was advised against it a number of times, or people just didn't think it was a great idea. Surgeons shouldn't talk about complications. Surgeons shouldn't talk about the unhappy patient. And yet, I really think we should, right? It's part of life. It's part of the practice of plastic surgery. It's certainly part of people's experience when they go to med spas. Some of the unhappiness can come from either poor communication on the part of the providers, poor communication on the part of the staff or the patient themselves even to express what it is that they want, poor understanding. We know that sometimes there's a disconnect between what we say and what people hear. There are some technical misadventures that do happen from time to time. I'd say the great majority of my work as a secondary plastic surgeon, where I will redo or revise someone else's work, the patient may feel it was a technical misadventure, and most commonly it was due to a miscommunication, misunderstanding, or a missed opportunity to manage expectation. So now you have a patient in front of you that's unhappy, and how do you handle it? And I would like to hear from you to tell me if you've had an experience, my office or anybody's office for that matter. You don't have to go into details, but you might say you had this experience or that experience and how it was resolved, or if you have a question, feel free to ask and I'll try to respond to them as quickly as I can. In the meantime, there was a story this week, myself. I went in to see a patient who had a procedure, an injectable procedure, and this person was, I thought, disproportionately unhappy with their results. I thought their results were very reasonable. And the disconnect was in my version of reasonable and this person's version of reasonable. And I think what happens is if you scroll through Instagram or Facebook or social media in general, you will see people present glamour pictures that have either been filtered or photoshopped or edited in some way, but basically the best of the best. And I think that the conversation should turn more into what is a realistic expectation and what's a realistic understanding of how these products and procedures are going to work in you and your body and your tissues. So I think the way to navigate unhappiness is to understand how you got there, both from the doctor side and the patient side, and then create a plan that can either get you out of the unhappiness. Maybe that's just letting time pass for the material to resolve or absorb, the scars to soften and heal, and really give that surgeon or doctor or injector or esthetician a chance to try to better understand where the disconnect was and what can be done to make things better. You know, unfortunately, all of these services at some level cost money, and people get frustrated when they have the expectation that they're buying a toaster or they're replacing a piece on a toaster, and they put down their hard-earned money and they expect that part to be as perfect as if it was new. The problem is we're really not replacing parts in people. The parts are all getting older. The parts are all exposed to sun damage and alcohol and cigarette smoking and whatever else we may bring to the table. And so the understanding has to be that all of these goods and services and procedures are aimed to make you a better version of you, if that's what you're looking for. Can't make you look like somebody else, can't make you be somebody else, can't give you the tissue of a younger person. None of that really exists. Well, I don't know if this rambling is helpful to you. It's been on my mind for quite some time. The event this week really sort of kicked it into a higher gear. I would really like to use this as an opportunity to engage in some dialogue. So if you've had an experience, again, with my office or anyone's office, I'd like to know about it. And I'd like a chance to discuss it. Obviously, there are some rules to the game. We can't talk about your particular issue. If you identify yourself as a patient, I can't respond to that, at least as one of my patients, because that's a violation of privacy unless you say in your posting that I'm allowed to respond, and then we will, and we can try to dialogue about it. Well, I hope you're having a great day, and I really look forward to hearing from you, and we would very much like to see you at Baumholtz Plastic Surgery. Be well.